Do you know what the leading causes of infant death are? This is a question that no one wants to think about, but the reality is that it's an essential topic for discussion. Infant mortality is a global issue that affects families and communities in heartbreaking ways. Knowledge about its causes is not just vital for health professionals, but it's equally important for the wider public to be aware of this issue. By understanding the leading causes of infant mortality, we can begin to identify preventive measures and possibly save lives. This knowledge can empower us to make informed decisions about the health and safety of our little ones. It's a daunting subject, but it's also an opportunity for us to gain insight and take action. It's a heartbreaking topic, but understanding these causes can help us prevent them. So, what are these leading causes of infant death? Let's start with sudden infant death syndrome, commonly known as SIDS. This is the leading cause of death among infants from 1 month to 1 year old. It's a mysterious and tragic occurrence, often happening during sleep, and the exact cause of SIDS remains unknown. Next up, we have premature birth and low birth weight. These are significant risk factors for infant mortality. Babies born too early or too small are more susceptible to health complications, and unfortunately, they have a higher risk of not making it through their first year. Third on our list is birth defects. These are abnormalities that can affect various organs or systems in the body. They can be present from birth or develop later in infancy, and they contribute to the sad reality of infant mortality. Now let's talk about maternal health. It plays a crucial role in infant survival. If a mother's health is compromised, whether through inadequate prenatal care, substance abuse, or medical conditions, it can significantly increase the risk of infant death. Lastly, we have accidental suffocation and strangulation in bed. These are heartbreaking, preventable causes of infant death. Unsafe sleeping environments, such as soft bedding, sleeping on soft surfaces, or sharing an adult bed, can increase the risk of suffocation or strangulation. These are some of the leading causes of infant death. It's a heavy topic, but one we need to discuss openly and honestly. Each one of these causes is a critical piece of a larger puzzle. By understanding them, we can start working towards solutions, towards prevention, and towards a future where fewer families have to face the unbearable pain of losing an infant. Knowledge is power. Now that we know the causes, let's delve into how we can prevent them. Prevention is always better than cure, especially when it comes to our little ones. Firstly, we have the safe sleep practices. This involves placing infants on their backs to sleep, on a firm surface like a crib or bassinet. It is also important to keep the sleeping area free from soft bedding, pillows, or toys. These steps can significantly reduce the risk of sudden infant death syndrome and accidental suffocation. Next, we have prenatal care. This refers to regular checkups during pregnancy to monitor both mother and baby's health. It's an opportunity to identify and manage potential risks early, promoting a healthier pregnancy and a safer birth. Preventing premature birth is another crucial step. This involves promoting healthy behaviors during pregnancy, like a balanced diet and regular exercise, and managing chronic medical conditions. Providing early intervention and support for high-risk pregnancies can also help prevent preterm births. Immunizations are a vital part of infant health. Vaccinations protect infants from various infectious diseases, reducing the risk of illness and death from preventable infections. Breastfeeding is another key prevention measure. It provides a host of health benefits for infants, including protection against infections and a reduced risk of sudden infant death syndrome. Lastly, we have education and support. Providing parents and caregivers with information on infant care, safe sleep practices, breastfeeding, and injury prevention empowers them to make informed decisions. It helps create a safer environment for their infants, reducing potential risks. Remember, these prevention measures are not independent of each other. Instead, they work together to provide a comprehensive approach towards infant health and safety. It's a combined effort that involves everyone, from healthcare providers to parents and caregivers. These prevention measures can significantly reduce the risk of infant death. So, let's all do our part to ensure the safety and well-being of our little ones. To sum up everything we've discussed today, the causes and prevention of infant death are multifaceted, and understanding them is key to safeguarding the lives of our little ones. The leading cause of infant mortality is sudden infant death syndrome, or SIDS, which often occurs without warning during sleep. Premature birth and low birth weight also present significant risks, leaving babies more susceptible to health complications. Birth defects, whether present at birth or developed later, can contribute to infant mortality. Maternal health and prenatal care factor in heavily, with poor maternal health and inadequate prenatal care increasing the risk of infant death. Lastly, accidental suffocation and strangulation in bed, often due to unsafe sleeping environments, are preventable causes that tragically take many infant lives. Prevention strategies are just as comprehensive, starting with safe sleep practices. Infants should sleep on their backs in a firm crib or bassinet, free of soft bedding, pillows, or toys. Adequate prenatal care is essential in monitoring both maternal and fetal health, identifying risk factors, and promoting healthy pregnancies. Preventing premature birth through healthy behaviors during pregnancy and early intervention for high-risk pregnancies can drastically reduce infant mortality. Immunizations play a critical role by protecting infants against infectious diseases, thereby reducing the risk of illness and death from preventable infections. Breastfeeding is highly beneficial for infants, offering protection against infections and reducing the risk of SIDS. Lastly, providing education and support to parents and caregivers on infant care, safe sleep practices, breastfeeding, and injury prevention empowers them to make informed decisions and create safe environments for their infants. With awareness and proactive measures, we can help ensure the safety and well-being of our little ones. Thank you for being with us today. Don't forget to like, share, and subscribe for more valuable insights and content.